seems to be that Georgia Tech is testing nearly 5 times as many students as UGA, and this is a problem. So how do we kind of navigate around this and kind of get more funding so we can test more people, and that?
Yeah, can I just, I think that we all want to have more testing, and the challenge, and others can add, but it isn't just about funding. It isn't just an issue of just having enough money to buy the test. There's no test to be purchased. What has been done, and actually the areas to increase capacity are going in two directions. One, like what UGA already has done with the College of Veterinary Medicine, of actually developing a test that is approved, it's called CLIA approval, that is sort of a rapid way of getting a test that is just being used on the local area. And that actually has led to a capacity of about 1,500 tests a week, and that actually it is important. The other aspect is just what Georgia Tech have done. What they have come up with is a saliva test that actually is a very good test so far from what we have seen. But in order for it to be implemented, again, this is test they develop, so they cannot just sort of put it in a box and send to us. What has to happen is that then and it could be moved to UGA, but it has to go through the whole process of being verified that actually works just as well as it did or it's working at Georgia Tech. And some of those things are happening. Actually, one of the questions in the meeting that we had with CDC that Dean Davis organized is actually looking at comparing whether saliva testing is more acceptable and actually could work as well, because it can do two things. One, it would expand the capacity testing, but also have the ability to, instead of doing one test at a time, you could do something that is called pooling, that you could have, say, if we know that only like 3% or less than 5% of the tests are positive, you could actually have tests like 10 at a time, and actually only 1 out of the 10 may end up being positive. And then you can just sort of, that way you can do a lot more, much quicker, and then identify the single one that is positive. All those things are in the works, and again, this is a part of going through a challenge that is new, and we are actually having to develop other tests. It's just like the example that Dean Davis mentioned on having to create a little machine out in outer space to just reduce the CO2. Literally, that's exactly what we're doing in many ways, and out of that, I think we're going to end up with a better platform of testing that could again be available not only for COVID but for other emerging diseases that are likely to come a little bit later.
Kashni, I'll speak to the policy question, sort of the policy engagement question, if you will. So Dr. Cordero has a lot more specialization on the testing side, but I can tell you that I certainly agree that we need more testing. And I also think that we, as a university and as a university system, need to be learning from other universities that are doing this really well. And there are examples of other universities that I think have scaled up their testing. I mean, there's a lot of conversation. We put a link in the chat window here. The FDA has done some rapid approvals of some saliva testing, some of the kinds of testing that Jose was just mentioning. I think that press release is really interesting for you to read about. One of the things that's really interesting, of course, that we have to keep an eye on is a lot of these technologies are evolving in real time, but we just must be able to keep up with the evolution of those technologies, and as a university system, not just UGA, again, as a system, be able to respond to and integrate those technologies as they become available, especially the ones that are really cost effective. But as far as policy engagement goes, I mean, First of all, one of the things that Marcia and I talked about yesterday is really making sure that our students are registered to vote, that they know where to vote, that they do vote, that political engagement is really important. I think giving your representatives a call at the state level, your state level representatives, is really important. Phone calls are still really important. Emails are important. I think as much communication you can do with your peers, I think PHA can take an amazing leadership role in this space and really educate the College of Public Health and other UGA students more broadly about political engagement and how to engage not just in voting, but of course in letting your voice be heard in advocacy efforts. And so that's the time to do this now. As Dean Davis said, I think our time is now. I think the more you can be a vocal and collaborative public health steward, I think the better. And so just, make those phone calls, send those emails, do as much as you can, I think, to encourage an evidence-based approach to expansion of testing and to ramping up our efforts for any aspect of mitigating or managing the disease.
Yeah, that's a great point. I just want to add, I think the important aspect, especially when going to your legislators and to other community leaders, is that you as a public health a student or public health leader, what you're doing is educating the leadership on the public health perspective of the issue. And that way, I think the more they learn and understand, the better decisions they can make.
Thank you, Dr. Cordero and Dr. Adams, for those really great responses.
So can I give you a slightly different perspective on this?
Certainly.
Okay, so I'm going to just, I appreciate all of the comments that have been made. I think those all are relevant and true, but I'm going to try and represent the other end of the spectrum, which is UGA has far more potential capacity than Georgia Tech can dream about. We do. Why don't we use it? Because there was a failure to recognize opportunity as opposed to recognizing barriers. That is the difference. Georgia Tech faculty convinced their leadership to recognize an opportunity and how you would have to be nimble and innovative to seize on that opportunity. UGA did not. Other universities have been nimble and figured out how to get it done. How do they test all the students coming into housing at universities that are just as big as UGA? It's because they prioritized it, they innovated, and they figured out how to get it done.
Thank you, Dr. Glenn. That was a really great response, and thank you for bringing a new perspective to this. One more question from one of the students in the panel is, what is the reason for reporting cases on a weekly basis rather than reporting them on a daily basis?
I think the reason for doing that is to at least this is, this makes sense in some ways, that the numbers could vacillate differently by day. You see that with the Georgia Department of Public Health. Mondays are always low, Thursdays are always higher, and I think the thinking in presenting it by week is that will smooth out any blips in the data to not artificially worry or artificially calm.
I agree with that, and let me say that in our project in Puerto Rico, we have been working with the Public Health Trust there and the Trust for Science and Technology, and together with Yale and Harvard and Hopkins in terms of looking at different models. And at the very beginning, we try to do things on a daily basis, but actually have settled on for the purpose of modeling and purpose of understanding the data, a weekly basis had turned out to be a perhaps a more robust way of doing it. So that's the kind of thing that you only learn with time and trying different options.
Thank you so much. So I have one more question about the Clark County Institutional Cross-Functional Team. So question reads, what is the University of Georgia doing to work with Athens-Clarke County and the return to in-person instruction cross-functional team at within the county? So to date, the CCSD team has indicated that the university is not working with them to help coordinate a self-return to in-person classes. So are there any thoughts, or is there anything in the making to make this possible, to make it safer for our students, faculty members, and staff members to have a functional in-person class setting?
Can I ask a clarification question? Did you just mention CCSD, Clark County School District?
Yes, ma'am.
Okay, can you restate that aspect of the question,
Do you want me to restate it, ma'am?
please? Yeah.
Okay,
Yeah.
sorry about that. So
Me too. Thank you.
sorry about that. Thank you. The question reads, what is the university doing to work with Athens-Clarke County and the return to in-person instruction cross-functional team at CCSD? To date, the CCSD team has indicated that the university is not working with them to help coordinate a safe return to in-person classes.
Okay, I can speak to that. First of all, I think I want to differentiate for the people on the call the difference between ACC Gov and CCSD. I think that's really important. So we've got the local government, which is Athens-Clarke County local government, and then Clark County School District, which I believe is the focus of the question. Is that right, Keshni? Yeah. Okay, so I actually have been in contact, weekly contact with Amy Rourke, who is the director of school nursing and who is on the who is really leading the charge in terms of informing the public health perspective and clinical perspective for Clark County School District, and have worked closely with her. I know she's also gotten advising from Marky Bell in epidemiology, and have a great relationship with her. So that's the College of Public Health's relationship to CCSD at this point. CCSD is also a partner in Athens Wellbeing Project, and so I definitely provide data to them as needed, and did so not so long ago, just a few weeks ago, when Zernona Thomas, the current superintendent, actually asked about internet accessibility, and we leveraged the Athens Wellbeing Project geospecific data at the elementary school attendance zone level to inform their policy and planning for virtual learning. So those are some specific partnerships and specific collaborations or contributions that the College of Public Health has right now with CCSD. I can't speak to University of Georgia more broadly or as a whole, but the College of Public Health has a good working relationship with CCSD and has for quite some time. In addition to that, the Athens-Clarke County government composed an epidemiological advisory group early on in the pandemic. This is the local government. Dean Davis, Dr. Cordero, myself, Dr. Jessica Mullenberg, and Lauren Baggett served on that group, and that group regularly met in late spring, early summer to make plans and decisions, sort of inform the public health perspective and clinical perspective for local government action. So just some specific examples to the collaboration of how we lend and leverage the expertise of UGA's College of Public Health into the community and community decision making. I hope that helps answer the question.
Thank you so much, ma'am.
All right, if there's no more questions in the chat, we'll go to the next one, which I think we did kind of cover the next question. It is more about testing, but if there's anything else anybody wants to add to this, they can before I go on, and if not, I'll just go to the next one. But it was just asking what's being done at the health center to increase the number of those being tested so that experts can sufficiently identify any clusters or adequately isolate those who are infected. And I think Dr. Adams and everybody touched on the fact that we're trying to increase the capacity, and that just the saliva test with VetMed and everything else. So if there's more to add, go for it.
I had a quick question in response to the comment about the USG requirements. And I guess I'm a little confused if the USG requirements are a minimum for what needs to be done, or if it's like a hard stop of what we're allowed to do. I know that Georgia Southern has been doing in-house contact tracing in conjunction with the Department of Public Health. It's a really comprehensive program. People are required to participate, which seems to be different than the USG requirements. So I'm just curious how binding those are. If those are recommendations and then we can go above and beyond, or if we have to just do that. Does that question make sense?
It does. I'm going to take a quick stab at that on the contact tracing perspective, and then Marcia, I think you'll probably have some to add about the USG aspect. So Meg, of course, you've been my partner in developing the contact tracing course, and certainly even in mentoring some of the students we've had in the field. I'm really passionate about contact tracing. In my ideal world, we would have an in-house contact tracing team at the University of Georgia that's partnering with the Department of Public Health. And there isn't any sort of legal or policy barrier to that. It truly is. We need to have some institutional buy-in from the University of Georgia. But my understanding is that we actually are not bound by law, for example, for the Department of Public Health to solely handle that. And there are examples, not just Georgia Southern, but Emory, for example, has their own in-house contact tracing team, and they're working hand in hand with the Department of Public Health. I think that there's a lot of variation. We've got people on this call who have served as a contact tracer in the field. District to district, there's a lot of variation with the Department of Public Health and the implementation of contact tracing and the partnerships, the community partnerships and collaborations that those local departments of health have with institutions of higher education. And so just to be completely transparent, I really think it is a matter of having the institutional buy-in from the University of Georgia and a really healthy, robust partnership with the Department of Public Health between the University of Georgia and our local District 10 Department of Public Health. And that's something that Dean Davis and I continue to work diligently on both sides. And again, you know, it's just, there's only so much control that we have over that. My understanding is that we do have some latitude around that as an institution, but we're just not there yet. And Dean Davis, feel free to correct me or add on to that.
No, we have had many calls with our district office. We have, I go back to my email on May 11th, we presented a very comprehensive plan to them about how we could help. And I think this is one of these times where I think UGA is more eager to help than the district office. So if we were to be placing where the barrier is on this, it's not USG, it's not UGA as much as it is the district saying, thank you, we know you are there, we've got this right now. If we need you, we'll let you know, but thanks, but no thanks.
Thank you.
All right, so we'll go on to our next question, which is UGA prepared to deal with a cluster outbreak given the current testing rates?
Let me just try to answer that. And I teach the field epi class in our college, and current testing rates, it's just one way to identify a cluster, but most likely the cluster is going to be identified in terms of the symptomatic cases that there are. But having said that, the process that is being outlined, and Dr. Davis just mentioned, if there is a cluster, it's going to be the Department of Public Health who's going to be doing the investigation, and they may actually call in CDC. That's actually what happened in UNC with the outbreak that they have over 600 cases, and it was started by UNC, by the Public Health Department in North Carolina, and then they brought the help of CDC to understand that cluster. I think that would be the process that will also happen if there is an outbreak within UGA.
All right, thank you for clarification on that process, Dr. Cordero. Our next question also has to do with testing, and it is, what are the risks associated with false negatives, especially in the rapid tests, and how can UGA combat those risks?
Okay, I'm glad that you have another question on testing, and because it allows me to do, as you can say, I think Grace and Dr. Davis have actually heard me talk maybe more than I should on testing, but it is really important to clarify that there are two kinds of tests. One is the PCR, the molecular test that tests whether the virus is present, and the other is the serology test, which really is the antibody response to having the infection. And they're rapid tests both for PCR and for serology. And the ones that actually have had a lot of problems are the rapid tests for serology that actually have, especially something called linear flow approaches. And many went into the market without a proper testing. And actually, when many of them were tested, the FDA ended up taking those tests out of business and say the approval is just no longer there. The way that I would suggest that using the rapid test is that there are only a handful that actually are really proven shown to be effective. But there are tests and actually some opportunities that we are exploring and collaborating with CDC to do some serology testing to just find out what percentage of the faculty, staff, and students already have had the infection and how does that change over time. That's how those tests could actually provide some meaningful information. But for using figuring out how the disease been transmitted, we do need to continue to do the PCR tests and have the results as quickly as we can, meaning 24, no more than 48 hours.
I'm going to note here that UGA has a fleet of PCR instruments and an army of individuals who are trained how to use them. Now, they're typically trained to do things like test for plant pathogens, all kinds of different things. But if you had the right system in place, you could tap into that standing available system, right? But you can't do it just through technology. You also need policy, you also need legal expertise, all of which occurs at UGA. So if we were willing to innovate, it could be done quite rapidly, especially because other institutions have shown us the way. It's really a matter of want to.
Yeah, I agree with you, Travis. Let me say that this is probably not happening as fast as it should or as widely as it should. But something I just learned yesterday in talking with our colleagues in vet medicine is that kind of conversion is what actually the Griffin campus that does a lot of food testing and testing of other pathogens. They're actually working hand in hand in doing the testing for COVID as part of this 300 or more samples. And so it's probably happening too slow. But the idea of actually using some of this technology, it's sort of beginning to take hold. Yeah.
All right, thank you for those answers. Did anybody else want to add to that before I go to the next question?
I had a question that just popped up, and this is addressed to Dr. Glenn, but of course anyone else who does have any thoughts can obviously address this question as well. Dr. Glenn, who can community members contact at UGA to push these processes forward? Or are we allowed to contact you directly to get a laundry list of demands?
Yeah, so you're welcome to contact me, that's fine. But honestly, the limitation is at the top. And as far as I can tell, many offers have been made by scientists on the ground at UGA, and we have never received a positive response by the upper administration. And until that changes, I don't know if you're doing anything more than tilting at windmills. Right? Because I mean, Georgia Tech's upper administration got offers of help from their biology faculty, and they were supportive and reached out, and that's why Georgia Tech has the system that they do. That's the difference.
All right, thank you for that question, and thank you for your answer, Dr. Glenn. So we'll go to our next question. which I know we've talked about how a lot of this is hands tied with upper administration and with the university system of Georgia. But is there a predetermined point, such as number of cases or rate of transmission, at which UGA will make the decision to go fully online again? And if so, how is that number or benchmark determined?
To my knowledge, we do not have a predetermined number.
Okay, thank you for that answer. We'll go on to the next question.
Could I comment on that last item?
Yes, of course.
In the meeting that we had that was called the Campus Conversation with Jerry, and I think Dr. Davis was there, and that question was raised, and the answer that we got, and I just want to clarify if that is still a part of the current answer that was just given, and that is that the decision on those numbers, those threshold numbers, was to be made at the USG level, not at the Georgia level. In other words, the individual campuses would not have a say in that. I mean, that sounds very strange, actually, but I just wanted to clarify if that is to anybody's knowledge is still the case, that it's going to be a top-down thing and it's at the USG level that the decision will be made, and that I guess, the decision about where you pull the switch will be made at the USG level. Is that still the case to the degree that there is a plan of any kind?
That is not what I have been told, because all the USG schools are very different. You have Georgia Tech and Atlanta. You have Albany State and Albany, Georgia Southern and Statesville. So I have been told this certainly will be in conjunction with USG, but it will be the individual institution with USG is what I'm guessing will be, and it will have to do with a lot of things like transmission in the community as well as transmission in the institution. So yes, that was a weird answer to me. I was not on that, but I've listened to it.
Yeah, well, thank you very much for your clarification on that point. It adds a little bit of more sensibility to it, but we still don't know. Nobody's modeling that we know about. Is that right? That we don't know what model whoever at UGA is doing this. I mean, we have the model that John Drake has released and made public. And are there alternative models that anybody is using? Or
again, that I'm aware of, and you're right, and we have so many good modelers. So I'm hoping that that's happening, and at my level, I just don't know about it.
Yeah. Okay. Thank you.
Mm-hmm.
I do think that isolation beds is also going to be important.
Yes.
So there's 300 isolation beds, and if those get filled up, then that's going to be pretty problematic.
Mhm.
That's 300 in Athens, UGA. Is that what you mean? Yeah. Okay.
Yeah, there are a number of models that have been developed in different universities, and that actually could be used. But if the data are collected here in a way that then could be applied to the model.
I got the impression that there was going to be more transparency in terms of the ongoing observations through tech. And I haven't gone back to look to see on their website and so forth whether their data are public. Is it possible that other campuses, including specifically tech, might be more transparent about their conditions and their models that they're using for the fail-safe decision? Does anybody know if?
I'll speak to this just a little bit, only because I have spent some time on Georgia Tech's website looking at the data that they present. And I have seen no mention of a fail-safe or of a decision rule, a threshold for Georgia Tech. What I have seen is they are posting more daily data, and they've got more detail around the case data that they're posting on their website, and I do find that really helpful. And again, I think the question that Meg posed is a really important one, right? Like, at what juncture is the USG making the decisions, and where do we as an institution, as an individual institution, have latitude to make decisions around things like reporting and testing and tracing? And that question is really, really important to answer. I think there are other institutions in the USG system that are doing a better job at reporting data. I think we could improve the way that we do that. That's just my personal opinion, not the opinion of the University of Georgia. So yeah, Ann, I mean, I think you bring up a good point. And again, what I would just say is this is not a time for us to be isolationist. I think this is a really important time for us to look around and learn from other universities, both in our own system and in other states and private universities. I think it's critical that we do that we adapt, that we innovate quickly. And I hope to see us improve on that front at UGA.
Well, I'm glad. I'm hoping that you all who have the expertise are being proactive, because there's been a sense of kind of balkanization among the areas of expertise that I don't think it's deliberate. I think it's just an accident of how academia operates. But I'm glad to know that you're looking at other campuses, and hopefully some of those things can be made public. Thank you.
That's one of the things that I'm trying to learn from Georgia Tech as well. They have all this testing that's available, but they're having trouble getting students to participate. So, we think that, we can have all this testing and everybody's going to be there, but they're having trouble filling their slots, giving students incentives. So it's not just a build it and you're come. I think that's why it's going to take all of public health. It's great to have the test, but what do we need? What messages do we need to be given tests to people wanting to get testing? So we have public health in all aspects of these decisions that each of us have a role to work on.
Well, yes, apropos of that, we're concerned about interacting with our local health data acquisition operation in ACC. And is it the case, I was assuming, and I don't know, I have never asked Josh or anybody at Tech about this, but are they interacting specifically? I mean, the degree to which the 10,000 students at Georgia State might be implicated in exacerbating exposures within Atlanta is kind of going to be tiny by comparison to the 30,000 students added here in ACC. So I think maybe they're not necessarily paying attention to Atlanta, but I'm sure that Atlanta must be paying attention to itself and to some degree interfacing with what's going on at Tech, and serve as a model for the kinds of things that could be going on here.
Jessica, would you like us to take the question on the screen?
Yeah, if it's in the chat, you guys can go. Keshni, were there any questions in the chat? I noticed it blinking.
Can I ask one thing?
There was one question, yeah. And
it's kind of following up. Yeah, it was me. So I understand that from what I heard before and what you're saying, that the ultimate decision of like having a threshold to close the university, that's a Board of Regents decision, right? But what I'm
University of Georgia decision.
Say again, excuse me?
It is University of Georgia decision.
Oh, so that's why my question, that was actually my question, like that if there's anything that prevents UGA, even though the decision and the sort of executive, follow-up may be on USG, is there anything that prevents UGA from having its own threshold? Say like, this is our threshold. If we act on that, well, that may be to the, people in Atlanta, but is my question clear?
Yeah, I think it will be a partnership that takes into account, again, community rates, our ability to isolate and quarantine, and then our own rates and clusters. So it will be a lot of variables, but I think, at least I believe here, that it will be UGA's decision.
But aren't universities better equipped to determine that thresholds? I would think, like, in terms of,
Yeah.
well, I think what you were saying, like all the sort of like diversity of different universities. So why isn't the Board of Regents given, devolving that authority to the universities, given that they are, more in touch with what's happening on the ground? And because of us, I think Dr. Summers said, like, Atlanta and Georgia State is not the same as Athens and UGA. So why is the Board of Regents not devolving that authority towards to each university to determine their own policy?
Well, certain policies have to be made at a system level. So the decision to be in person, that's across all universities in the system. But some decisions can be made locally.
Okay, but the decision of like saying we are going fully online when we reach this point.
That will be an individual university decision.
Okay, but the UGA has not decided on that yet.
No, we don't know the threshold, but we will make that decision. The university will make that decision.
Okay, thank you.
Okay, well, that's where I want to get just a little bit more specific, if I can. It is like, well, who is this we? Dr. Davis, is it somebody or is it somebody you? Is it you?
Well, I think it will be the Medical Oversight Task Force in conjunction with the President's Office.
And they're operating with some models.
Yes.
Okay, thank you.
So Keshni, if you want to share the question that came in on the chat next, and then we'll do the one on the screen. And I know we said that this would wrap up around 1, so that might be our last couple questions we have time for today.
What was the question that was asked? They already asked the question, yes.
Okay.
Yeah.
So yeah, if we want this to be our last question, if anybody wants to speak on what happens if UGA decides to go online before Thanksgiving due to an outbreak, and what the plan is to make a more unexpected transition go smoothly, such as the 2-week grace period we had when we went online in March last semester.
Well, I have to say that our faculty did a great job with the unexpected transition in March. We learned a lot from that. We have been surveying students on what went well, what didn't go well. We'll try to overcome those. But I think our faculty have been engaged this summer in community learning around online education. So my anticipation is that it will go a lot smoother than March. If we don't learn from our lessons, then that's shame on us. But I do have to run to another meeting. We're having our first alumni working board meeting. So that's an exciting thing. I want to have a better relationship and get expertise from our alum. I just like to close by saying that during this time, it's so anxious around so many different variables. So I would just ask us to keep communication open. These are the answers that we have today. This afternoon, I could have a different answer on things. So just be patient with us as things change, as opinions change, as science changes. So please keep communication open. Know that I'll take emails or calls anytime, as will any members of our panel. Take advantage of us in that conversations. And second of all, I want us to keep in mind these difficult conversations that we have to have around COVID, around testing, around thresholds, around things that we didn't talk about today, but the things that we want to address this year in the college with diversity. And that's, I guess my advice is to keep everyone's perspective. That's how you're a good public health professional, I think, is to understand why people think the way they do. For every one, or I don't have a data on this, but for people who want online learning, there's someone else who's saying, I'm lonely, I want to be in a classroom, even if it's socially distanced. So we might have the best practices for public health, but how can we help other things that might come from online, like loneliness and depression? So there's not just one right answer on all of this. It's coming together as a community to come up with those answers. So that's what I ask for from our students, and that's what I ask from our faculty as well. So I'll close by saying what Grace said earlier. We're in this together. Let's make this a very good partnership, because we've got a lot of challenges to get through together. So thank you for having us here. Jessica, thank you and the association for having these panels. It's just a fantastic idea. Thank you.
Thank you, Dean Davis, for coming and talking, and to all our panelists for coming and talking. I really learned a lot. I hope everybody else did as well. The panel will be recorded and is going to be posted to our Instagram and Facebook if anybody wants to circle back to it. And I really hope everybody will register and attend our other panels that we're going to have throughout the semester. Our next one is September 10th with Dr. Adams, and we'll be talking about COVID specifically in Athens, Georgia, and how it's impacting the community outside of UGA. And that's all I have. Thank you guys all for attending, and I hope you have a great rest of your week.